in the name of Brazilian health professionals. We are amazed with your presence here with us, and in the name of WP Institute, it's really an honor to be with you here. So, well, I know that everybody thinks you're a Canadian, but I know you're not, right?
I am a Canadian.
No, but you know, you have something to tell us about this, and also about your road to psychology, because your original profession is not psychology. So tell us about your biography and also how this road has to do with emotions and EFT.
Well, I was born in South Africa and was an engineer, and I have a master's degree in engineering. Yeah? So I came to Canada and did a master's degree in engineering in Canada. I was going to go on and become a nuclear engineer. But I was very politically involved in South Africa in fighting against the apartheid government. And so I was also a type of political refugee from South Africa. When I got to Canada, I lost that social, political relevance and started to seek for something that seemed more valuable. This was also the time of the hippie generation and the time of turning on and tuning out. There was a strong drug culture. But that was important because it began to highlight that we construct our world and it depends on the state of our brain. And I think that influenced me a lot. But really, when I left South Africa, I made up a decision chart. And I was involved in mathematical programming. And I made up a very complex decision chart. And it had all kinds of factors like the weather in the country. Coming from South Africa was very important. The prestige of the university, the amount of money that I would get in scholarships, other factors, right? And then I weighted each factor, like which was the most important to me. I developed a complex algorithm, right? And I put numbers down on everything, and I added it all up, and I computed what was the best decision. And it came out that Canada was the worst place to go to. And as soon as I got that computation, I said, I'm going to Canada, right? And that highlighted that you can't capture explicitly and rationally all the information to make decisions, and that I could know that I knew more than I could say. That what guided me was a larger sense than anything that I could make explicit. And in my final exam in engineering in South Africa, I solved a math problem in my exam that nobody else solved. And I didn't know how I knew how to solve it. So I began to be fascinated with the notion that I know more than I can say. At that time, Polanyi was an ex-Nobel Prize winner who was writing philosophically about personal knowledge and tacit knowledge. So I was really guided by that, and I decided to move into psychology. My wife was a psychology student. I knew something about psychology, and after some process, I decided to go into psychology and started to try to understand how this process of I know more than I can say works. And eventually, well, not eventually, but it was part of it, was that somehow emotion informs us. So I entered psychology in 1970. There were 2 books written on emotion at that time, and I began a search to understand emotion. Well, that's some of my biography.
It's quite a self-disclosure. It's quite a self-disclosure, you know, talking about emotion. One thing that I would like to ask you, you said you have a long history, you made a point, you construct a way of dealing with emotion, with people that are suffering. Nowadays, if you would think of something that's really new, or when you change from South Africa to Canada, what do you think right now is happening that's really outstanding in your area?
Well, you know, the standard answer would be to say the neuropsychology or the affective neuroscience, study of the brain and understanding. But I think this is very primitive now. The fact that the brain lights up in different areas doesn't really tell us anything. And I don't know if people know, but there's this dead fish story where people have put a dead fish in an fMRI machine and it's lit up all over the place, right? So people are using fMRI to just validate their own theoretical biases. But it is interesting, and it's definitely an advance, actually studying the brain and understanding emotion in the brain. So I do think that, I mean, in my area, the emphasis on the study of emotion, and that people are paying attention now, the degree of, the increase in literature on emotion has increased exponentially in the last decade. And so just the fact that everybody is looking at emotion now, I think is probably one of the most important things. I think the other thing is the move towards psychotherapy integration. I'm a founding member of the Society for the Exploration of Psychotherapy Integration, and I think ultimately my hope is that we will move away from schools of psychotherapy toward understanding processes of change.
Well, we have too many schools, different schools of psychotherapy now. So you believe that emotion may be the core thing that integrates the psychotherapy? That's what you're talking?
No, I think we will have a field in which we understand emotional principles, cognitive principles, behavioral principles, interactional principles, and neuropsychological principles. And that's what we will teach our students, and relational principles. And there's something in everything. But on top of that, I do believe that emotion is our most fundamental processing system.
And if you would like your daydream, you know, from 10 years from now, how would you like psychotherapy or emotional as a tool for psychotherapy would be 10 years from now, if you would guess or if you would wish?
I mean, my wish, which will not be achieved, is that there will be no schools of psychotherapy, and that psychotherapy will be based on knowledge, not power and politics.
Well, Professor, in EFT, we have so many advances because we have EFT for trauma that is conducted by Sandra Pavel, right? And you also have now EFT for families, right? For couples. I don't know if you have EFT for kids. I don't know. But I want to ask you about this new things in EFT, the future of EFT. Show us about what you think about this.
Well, you know, there are advances going in different directions. So one of the areas is EFT with children and families. There's no study yet of EFT with children. And at first I used to be cautioning of using this with children because we really hadn't had enough experience. But now I've been supervising some of my former students who work with children, and I've been amazed at seeing them use two-chair dialogues with 7-year-olds, with 14-year-olds, and using it very successfully. But it needs to be modified to some degree. And there is a development in both the couples therapy area on working with families, but also in the individual therapy area where, and I'll just mention this because it's very radical, coming out of working with eating disorder, at first people worked with, let's say you have an eating disorder, a client, and let's say it's a woman, they would bring the mother in and work with the mother having a dialogue with an empty chair with the child, and then they bring the daughter in and have the daughter having a dialogue with a mother in an empty chair to help them resolve unfinished business, and then afterwards they bring the mother and daughter or the family together as a couple. But now an approach that's being used is they just work with the parents. Now, I'm not doing this, but they just work with the parents, and they coach the parents to be empathic towards the child, to apologize towards the child, and to ask the child for forgiveness. So this is a very radical and interesting innovation. And the thing that happens is immediately the parent says, I can't just ask my child for forgiveness, that's not right. I didn't do all bad things. I can't just say sorry to my child. And then they work on what stops you from apologizing to your child. And when I first heard it, I had the same reaction. I have children now, 37 and 41. I think they would love it if I apologized to them and asked them for forgiveness, right? But there's a block in doing that. But I think it could be quite curative. So that's just a very interesting and unusual path. My goal, I've retired as a research professor, but is for people more and more markers and tasks to be studied. I've developed an approach to psychotherapy research called task analysis, in which you take actual therapy and you study how do people resolve anger, how do they resolve sadness, how do they... My last doctoral student is working on how do people resolve shame in psychotherapy. So I think we really need to start studying each of the emotions and look at how people change.
One thing that came to my mind, you're talking about childhood and expression of the parents' emotions. And if you could think about emotions are our signals to deal with our body and our mind, our thoughts, and how would you use your therapy as a prevention for childhood learn before they get sick to express their emotions or recognize them? How?
Yeah, I think John Gottman is someone who's done research, and he talks about the parent as an emotion coach. And basically you have to teach parents essentially to be empathic to children's emotions. That means you have to have a positive emotion attitude yourself. You have to think emotions are good things. So first, as the parent, you have to work on yourself. Then you need to approach emotions in your child as an opportunity for intimacy. It's an opportunity for closeness and connection. And you have to accept the emotion of the child. But most parenting still says something like, you've got nothing to cry about, don't be such a baby, those kinds of negative evaluations. So you've got to approach the child's emotion, and then once you've accepted and validated the child's emotion, you give guidance as to how to deal with that emotion. It's like, I understand that you're angry that your friend Johnny took your truck. Don't hit him over the head with it. Tell him, I'm angry. Right? So that's guiding him to express his emotion rather than act it out. So I think the important thing is to train parents as emotion coaches. It's difficult to take a child in school and teach them about emotion, although that can be done and is being done. But I think you really need to work with the parents, with the teachers, and with doctors and nurses, and teach them to be good emotion coaches, and they will, in real life, give the child the kind of education about emotion that will be necessary. One of the things that somebody once said to me, because we've studied forgiveness for about 7 years, we had a grant to study forgiveness, somebody said, you know, we teach our children to apologize, but we never teach them to forgive. And I thought that was very interesting. I mean, there's just not that much that we do in emotion education of our children.
So, Professor, well, EFT is really absolutely an integrative approach, right? You have client-centered, you have eugen with focusing, right? And psychoanalysis maybe with attachment issues, right? So I want to know about your training, because for us it's really amazing, you know, Gestalt therapy, right? So what were your trainings before the development of emotion-focused therapy?
So I trained first as a person-centered, client-centered therapist with a student of Roger's, Laura Rice, and she was really my mentor. She developed the systematic evocative unfolding. I was her doctoral student, and together we developed this. And then I was trained as a Gestalt therapist, and I was trained with somebody who had been trained by Fritz Perls. And then I trained with a student of Piaget's, Juan Pascual Leone from Spain. And so I absorbed a whole approach that comes from Piaget. And then I trained as a systemic therapist in Palo Alto. I trained with Virginia Satir. I trained with Mnuchin. So I trained a lot with some systemic therapists. And then all along I was doing research. And I was studying psychodynamic therapies. I was also schooled in psychodynamic theoretical approaches, not in practice, but in the theory. And then I began self-teaching myself about emotion, reading and trying to understand emotion. And then I synthesized all of that.
You told us now that you have a long journey, very eclectic and very open from the beginning to the end. Most people here are training for being psychotherapists or are psychotherapists in the beginning of their journey or the half of the end. What would you say for us as an advice?
be curious and be not knowing. I think the worst enemy is to know and to think that you actually know. Human experience is so complex, we understand so little, that I think to approach things from a position of humility. Right now I'm on 2 panels, one in Canada and one in North America, setting the guidelines for the treatment of depression in North America. The problem is people act like we really know the answer. And I always counsel for humility. Research is important, but we don't have answers. And to pretend that we have answers is one of the sort of poisons of true understanding. So I think it's important to be questioning, to be open, to be curious, and not to feel you have to be an expert.
Thank you very much.
Thank you, Professor.